Okay, I'm going to talk to you now about St. John's neuromuscular technique. This technique is the lightest of all three of the techniques. It also goes on for the shortest duration. So this is the technique we choose in the most sensitive areas when there's maybe some long-standing inflammation in the area. That's also kind of piled on top of a trigger point. So we would use these techniques in the jaw inside intraorally to do medial and lateral pterygoids. I'm not going to ask you to do that on a patient this term. I will show you a self-treatment for it in your practical assignment for today's class. But I want you to watch the videos, Gail's palpation videos, watch me do it on somebody else, and then that's one of the techniques we'll make sure that we catch up on in the fall when I see you. I don't want you trying it on people because people have a lot of jaw issues and it can really be tricky, so I'd rather supervise you when you do that one. However, if you think about the muscles in today's outline, so for instance, temporalis and masseter, they're very delicate muscles. They're in delicate areas. There's no way you would probably want to go in with a full 10 pounds of pressure here. You're going to want to do a lighter pressure. And if somebody clenches their jaw or has some inflammation in the TMJ and these muscles are inflamed and have a bit of trigger points in them, then you would treat them with a St. John's neuromuscular. So St. John recommends that you warm up the area using myofascial release. So I'd want you to go in before you treat people today, make sure that you do the fascial release stuff. I'm kind of just miming it here. So you do that fascial release stuff in the neck. You could do the skin rolling over the neck, all the stuff that you learned in Tech 2 to warm up an area. Do that before you come in with this treatment. And because we're working in sensitive areas, it's very vital that you talk to your client about just breathing through everything. Remind them to breathe as you go through the treatment. So we're going to find temporalis here and treat it. So let's say Paige was having temporalis headaches and had some trigger points going on, or maybe she had some referral pain from her TMJ that was kind of creating a satellite or a secondary trigger point in the temporalis. So I'm palpating. You start at the temple and you work your way back in a fan. So you might be kind of massaging in this area and find a tender spot. So let's say there's a tender spot. Is this tender?
A little bit.
Okay, and where would you put that on a pain scale of 0 to 10, 0 being no pain at all, and 10 like putting your hand on a hot burner?
About 2.
Okay, so we're going to pretend it's a little more than a 2. It's something significant enough to treat. Does it radiate anywhere?
A little bit back towards the ear. Up and
Back towards the ear. Okay, so I'm just going to get you to take some nice deep breaths, and I'm going in and creating pressure, and this is for 8 to 12 seconds. So you only want to create enough pressure to elicit a response. So if she was at a 4, then that would be great. If it was too high, then I'd make a little bit less pressure. So that's about 12 seconds, and then we come out of the area, and then we could do a little massage. I always forget to ask the last question when I'm talking. So obviously before I released that pressure, I would have asked her where she was at on a pain scale.
Who's at a 0?
It's at a 0, okay. So I can go back in, and St. John's, because it's light and it's not, it's usually, you don't use any lubricant or anything like that. He recommends that you can go back in and do it up to 3 or 4 times in a session. So you don't want to overtreat these areas, and because you don't want to create more inflammation in the area. That's the theory behind the St. John's neuromuscular, is that we only want to elicit a small response in these sensitive areas, and then just enough to kick the body in to say, oh, that's something there, and then we come out, and then we massage it out a little bit, and then we could go back in and up to 4 times. And I've definitely gone back into the intraoral work that I've done with this technique up to 4 times. That's pretty typical. So if we did the masseter, we could do the same thing. So come down to the angle of the mandible, do some massage there. Can I get you to clench your jaw for me? Yep, so I know for sure I'm on that muscle, even though it's pretty an easy one. So let's say I'm massaging in here and I find something. So is this tender?
A little bit, yeah.
Where would you put that on a pain scale of 0 to 10, being 0 being no pain at all and 10 like putting your hand on a hot burner?
About a 4.
Good. And does it radiate anywhere?
A little bit up the jaw.
So it radiates up the jaw a little bit. Remember, masseter can radiate into the teeth even. And so I'm going to get you to just take a few deep breaths here. And I'm going to count 8 to 12 seconds. If this was really tender for her and she was having a hard time with it, I could use the distraction method by, say, massaging her shoulder while I did this, or maybe massaging her neck while I'm holding this for 8 to 12 seconds. And then where would you put that now on the pain scale page?
A 1.
And it's a 1. So I'm going to come out, and then I'm just going to do some more massage in that area to massage it out of the way. And again, return 3 to 4 times. When you're treating with St. John's neuromuscular technique, they recommend movement therapy for home care. So for home care page, I just want you to keep this muscle moving. So I'm just going to get you to open and close your jaw a few times. Good. And I'm going to ask you to do that maybe 3 times like that, a few times every day. So let's say 3 times a day, just to make sure that you're increasing that range of motion in the joint and make sure you don't develop any more trigger points in the masseter. So just something like that. So tell them they're movement therapy for home care. Okay?